Welcome to committee.
Thank you. Chairman Stein, Vice Chair Johnson, Ranking Member Lepore-Hagan, and distinguished members of the House Commerce and Labor Committee. Thank you for the opportunity to provide interested party testimony on House Bill 435. I am Lisa Keller, and I'm a member of Delaware City Council, and I have been for the past 13 years, and I'm also a business owner. The issue of vaccination mandates has greatly impacted the community that I serve, and daily, I receive communications from constituents who are either facing job loss or have already been terminated over vaccine mandates. Conversely, I've received communications from those begging for mandates, desperately trying to keep themselves safe in uncertain times. As an elected leader, I can sympathize with the position you are in and the difficulty of this decision. There are many varied and strong opinions on this matter. Let's begin with what I hope we can all agree upon. None of us want to see any Ohioan die unnecessarily from a virus. We all want a safe and healthy environment for our communities. All our lives, we've learned that medicines treat disease and vaccines prevent disease. When many Ohioans rolled up their sleeves to receive the vaccine, they did so under the premise that the vaccination would prevent them from contracting and transmitting COVID-19. I join you today from Delaware County, the most vaccinated county in the state of Ohio. Our hardworking health district has close to 80% of our eligible population vaccinated. That's those over 12. We should be the shining beacon on the hill for Ohio's pandemic response. Other county leaders should be coming to Delaware to see how a pandemic is crushed with the highest vaccination rate in not only the state, but the entire country. Despite this, we're still in the trenches with the rest of Ohio. Like every other county, we're red. We're considered to have a high level of spread. Our incredible health district developed its own innovative report card based on 5 critical factors to guide COVID-19 response based on the CDC's recommendations. As of our last report card, dated September 29th, Delaware failed every critical factor but one. Cases per 100,000, we failed. Positivity rate, we failed. ICU capacity, failed. Cases per 100,000 in schools, failed. The only metric we passed, our exceptional vaccination rate. As an elected official, I've had questions about how this could be, as I'm sure many of you would as well. I've spent hours with our health commissioner. I asked who is getting sick and who is being hospitalized. I learned while vaccinated individuals are faring better with hospitalizations and deaths, Delaware County is thankfully faring better than our neighboring counties. We are experiencing increasing numbers of breakthrough or fully vaccinated infections. Based upon the statistics that I requested and were published by our Delaware Public Health District on September 8th, between May and July, the fully vaccinated made up 21% of our cases, 41% of our hospitalizations, and 20% of our deaths. I heard vaccine efficacy numbers quoted yesterday in committee, and they were in the 90% range. I can assure you, the real-life numbers from the most vaccinated county in the state, unfortunately, don't match those efficacy numbers. What we're seeing in Delaware is not unique. On July 20th, the CDC published a report about an outbreak in Barnstable, Massachusetts. There was a large public gathering. 74% of the cases tied to this gathering were fully vaccinated. It was this investigation that caused the CDC to change their recommendations, requiring all persons, including the fully vaccinated, to wear masks indoors. The CDC changed this guidance because they had evidence the vaccinated were transmitting this virus. On August 6th, the CDC director said in an interview, "Our vaccines are working exceptionally well. They continue to work well with Delta. With regard to serious illness and death, they prevent it. But what they can't do anymore is prevent transmission. An investigation published on September 30th from a nosocomial outbreak in Israel substantiated the CDC's findings. In this publication, a fully vaccinated individual triggered an outbreak in a hospital, caused exposure to 248 people, 238 of them were fully vaccinated. All involved were wearing surgical masks, some were even in full hospital PPE. Of the 42 people infected, 38 were fully vaccinated. In this real-life scenario in a healthcare setting, a high level of vaccination and even surgical masks unfortunately did not prevent the virus from spreading, originating from a fully vaccinated individual. Regarding the observed results from this study, the authors state, it challenges the assumption that high universal vaccination rates will lead to herd immunity and prevent COVID-19 outbreaks. This was probably true for the wild-type SARS-CoV-2 virus, but in the outbreak described here, 96.2% of the exposed population was vaccinated. It's clear in Ohio's data, the vaccine provides a level of protection against serious illness and death in the recipient. We don't mandate medical treatments to protect individuals from themselves, however. If we did, we'd have BMI mandates, required daily exercise mandates. The very justification of a vaccination mandate is to prevent transmission of a disease to others. We don't want unvaccinated nurses putting patients at risk or unvaccinated employees putting other employees at risk. That part's never made sense to me, honestly, though, because I thought the vaccine provided that protection. Regardless, I've heard it discussed repeatedly that a business owner has the right to establish a safe and healthy environment without government interference. But if both the vaccinated and the unvaccinated can transmit the virus, according to the CDC and numerous scientific investigations, how does a business owner or healthcare facility's vaccine mandate stop transmission? Quite simply, it doesn't. And since it doesn't stop transmission, a mandate unfairly applies consequences only to the unvaccinated for a virus that both are capable of transmitting. We know spread has occurred on fully vaccinated cruise ships. I have observed vaccinated spread in the district I represent. Ohio Wesleyan University was one of the first universities to institute a vaccine mandate. Nearly all students and staff were vaccinated. We would have expected spread to be non-existent, especially nestled within the most vaccinated county in the state. Yet, there were nearly 3 times as many cases reported in the first 3 weeks of school than in the entire 14-week spring semester when there was no mandate available to students. These cases occurred in both the vaccinated and the unvaccinated. The mandate didn't stop the spread, but I could tell you story after story of the young lives that were forced to walk away from $100,000 scholarships, with college plans devastated because of this mandate. The CDC is abundantly clear on this. A vaccine won't stop transmission. Scientifically, it's been well established. Both the unvaccinated and the vaccinated are spreading the virus with similar viral loads. A vaccine mandate is therefore built on a false premise that a mandate will ensure a safe environment. Solid legislation should not be built on a false premise. To talk about what types of mandates are appropriate, when they should go into effect, what types of exemptions should be permissible. Wouldn't science first have to agree this mandate would do what it's intended to do? And if a mandate won't guarantee transmission of the virus won't occur in the workplace or the ICU, the only possible reason to issue a mandate is to impose one's will upon another and to be punitive to those not vaccinated, thereby creating a system where discrimination is not just permitted, but sanctioned. It's this very scenario when citizens need their government to intervene. The U.S. Chamber of Commerce fought the Americans with Disabilities Act. They lobbied against it, calling it the heavy hand of government. But today, individuals with disabilities have access to public places because elected officials passed legislation to protect them, even though they were a small minority. There isn't a single place on earth that has successfully conquered this virus through high vaccination rates, mandates, or forced compliance, but there are several places that have gone too far trying. We need legislation that prevents vaccine mandates from being issued. No Ohioan should have to ask their employer for an exemption from a vaccine that science has shown does not stop transmission. Employers need to first justify with some science that high levels of vaccine compliance have stopped the spread somewhere, anywhere. It unfortunately hasn't. Sub-House Bill 435 and the protections in this bill apply only to current employees, but not those employed after the bill's effective date. Nothing about this virus as it relates to workplace safety is likely to change once this bill takes effect. My biggest concern with the bill is it codifies an employer's ability to issue vaccine mandates without any justification at all. While it does provide exemptions, several are complicated and unnecessarily narrow. The medical exemption, for example, requires a primary care doctor. What if one's cardiologist doesn't recommend vaccination? One of the exemptions acknowledges natural immunity, but there's no scientific standard. It requires an unvaccinated individual's antibodies to be measured at the same level as a vaccinated individual. Is that a vaccinated individual 1 month after vaccination? 4 months after vaccination? When does this protection wane in vaccinated individuals? Is it different for each individual? Does age play a role? This is very complicated and full of potential unintended consequences. To simplify these complications, please consider this bill's exemption for reasons of conscience. This is essentially any reason. It's the same thing as saying vaccination decisions should be left up to the individual. This committee could simplify 34 pages of legislation, complicated exemption language, grandfather and sunset clauses, and simply say this on page 1. Since COVID-19 vaccines do not prevent transmission, individuals should make their own COVID-19 vaccination decisions with their healthcare provider, free from mandate, coercion, or discrimination, and should not be barred from employment opportunity or access to public accommodation based on vaccination status. Please respectfully consider substantially amending this bill to prevent discriminatory COVID mandates from occurring. Thank you to the sponsors of this bill, House leadership, and to the committee for further discussion on this matter that's so important to so many Ohioans. Thank you.
Thank you. Thank you for your testimony. I think you hit on many issues that many of us grapple with on a regular basis as to many issues related to the efficacy and to differing sets of data that say different things, and is one of the reasons there's many skeptics out there who, for whatever reason, feel that maybe at this time they're not ready to make that decision to be vaccinated. And that's part of why we're here today, is to try to determine where that line is between business and individual personal rights. But again, I think you did bring a lot of information to the table today, and I think there are a few questions. We'll start off with Representative Smith.
Thank you, Mr. Chair. Through the chair to the witness. Thank you for coming, Councilwoman. I was a councilwoman. It is the greatest job. I want everyone to do it. But I disagree with you on your point of view, so I want to talk through some things. So I want to say yesterday, I was the person who quoted the 95 or 90% plus statistics on efficacy. And so I just want to make sure that we understand what I said. So, and then I'm going to ask you a question. So according to the Centers for Disease Control, the Pfizer vaccine is 95% effective at prevention of COVID-19 prevention of lab-confirmed infections. The Moderna vaccine is 94% effective, same source, Centers for Disease Control. And the Johnson & Johnson one-shot vaccine is 86% effective against severe cases of COVID, and that came from a different source, from the Boston Globe, and I'm not sure what their primary source was. And I know that community health is important when you're an elected representative. There's been a lot of talk about whether transmission still occurs when a person is vaccinated. So, and here today we're talking about businesses, wanting to have the right to continue to operate without major disruptions, and whether they have a right to prevent an outbreak. And so I guess I wanted to talk about, the idea that when a person is vaccinated, though there might be another person in the room who is carrying a viral load, the person who has the vaccination is prevented from an extended illness, a more serious version of the illness. That's what the data shows. And from the standpoint of workforce, if you're shortening the length of an illness or the severity of it, that helps the business. And so I think that's interesting to consider. And then it also prevents death, which for me is valuable because I don't want to die from COVID. Okay, so, but the question is, from a community health standpoint and from a business standpoint in your area, are you hearing about outbreaks? Are you hearing about, and are you hearing about a number of businesses rushing to implement mandates for vaccines?
Through the chair to the representative, thank you so much for the question. The concerns that I'm getting mostly from my constituents aren't about outbreaks. The concerns are regarding some of the factories that we have in our city that have issued vaccination mandates. I received a message from a constituent who both herself and her husband work at this place of employment. They are facing job loss. I did hear from another constituent who has already been terminated. This individual has multiple sclerosis, and she's also a single mother who lost her husband several months ago. What her doctor couldn't guarantee to her, based on the data that they were looking at, was that the vaccine wouldn't accelerate her MS conditions. In her particular case, she already had COVID infection, and her doctor felt that that level of infection that she had already had was going to provide enough adequate protection for her until more data is available on that particular condition. This woman who lost her husband also then lost her job because she was not able to satisfy her employer's vaccination mandate. So I think what I'm hearing most are very nuanced situations. It's not people saying, I'm not going to get a vaccine because I think there are nanobots. I haven't heard that from anyone. I haven't heard very much vaccine information being spread. What I've heard is people with very nuanced medical issues, nuanced personal reasons for wanting to delay that decision perhaps until more data is available, but that is not currently an option for them. So I think somewhere in the middle here, there has to be a reasonable response to this to allow people to examine their conditions with their doctors and make decisions that are best in their individual situation.
May I have one follow-up?
One follow-up, yes.
In terms of, so we just talked about both the worker side and the business side. So it sounds like, actually, this is sort of a two-part question. So on the business side, there is one company that you know of that is sort of like the focus of your concern in your district?
I wouldn't say, I'm sorry, through the chair to the representative. I wouldn't say
I forgot
there's.
to do that too, I'm sorry.
There's one particular business that's the subject of concern. I mean, there have been multiple concerns. The university in our city has mandated vaccinations. There's several different companies that have issued mandates.
Okay, thank you. And so on the worker side, if I could just have the second part of the two-part question through the chair to the witness. So if you have 100 people and 80 are vaccinated and 20 are not, then there's a 50-50 split in cases. We need to be thinking about, what percentage of the population might be affected by a mandate situation, especially knowing that we had the Chamber of Commerce saying today that most businesses that he's aware of use mandates as a very last resort. They're trying to implement other steps to avoid mandates. And so I want to know on the constituent side, can you tell me how many constituents you've heard of who have concerns?
I'm sorry, I didn't hear the last part of your question.
Sorry, on the side of workers, the workforce and your constituents, do you know how many constituents have expressed concerns about losing their jobs due to mandates?
Through the chair, I can tell you that for probably the past 4 months, our city council chambers have been full of people every single meeting. The majority of them are begging for some sort of protection. Each one has a different individual story of what they're facing, both within employment within my city and some of them being employed elsewhere. We're also hearing from people who are saying, for the first time in the United States of America, I cannot go see a concert, or I'm not welcome in a place of public accommodation. I'm reading the news. Am I going to be able to travel? Will I be able to buy groceries or get my prescription medications at a pharmacy? And as an elected official in 13 years, I've never had people come to me and express very serious concerns about their ability to move in society like I am now.
Mr. Chair, but the answer to the question.
I've been very lenient.
I know, but
We need to move on.
that didn't
I'm sorry.
answer the question.
Maybe we'll come back to you.
Okay.
Representative Jones.
Thank you, Mr. Chairman, and thank you for your testimony through the chair to the witness. So I appreciate your information. I mean, it's very to the point. I think it's what we hear from a lot of our constituents. But I think the situation you have brought forth with being from Delaware County, the most vaccinated, it really highlights some of the need for what we're trying to accomplish with 435. Have you had any of your constituents or anyone say that they have been denied a medical or religious exemption by any of their employers up to this point?
So that's really what began a large degree of my advocacy into this matter. I was contacted by families of students from Ohio Wesleyan University. I can provide these letters if you'd like to see them, but I had a particular student, she would be okay with me stating her name, is Jennifer Garner, and her family's from Arizona. She had a significant scholarship at Ohio Wesleyan. Her doctor, her pediatrician, wrote a letter stating that this doctor had been treating her since 2006, gave a very specific reason why this doctor did not recommend that she be vaccinated. Ohio Wesleyan wrote a letter back to this student stating, your exemption request for a medical is denied, and we hope that you will receive the vaccination anyway and become a student at Ohio Wesleyan. That family contacted me. I had a meeting with the university president and the dean of students. It lasted several hours. The family also got a lawyer. That medical exemption ended up being reversed, and it was accepted. I'm not certain if there wasn't involvement from elected officials. I actually proposed legislation in our city to address this situation, and my fellow council members determined that this was best decided at a state level, which I would agree. Ideally, we would be focused on this at a state level. There's still several students from Ohio Wesleyan that are waiting on religious exemptions that have been denied. They're hoping to resubmit. There are other students who walked away from several $100,000 scholarships and went to other schools. I know of one girl in particular that transferred to another school, and then they issued a vaccine mandate after she had transferred. There was a senior who had 2 classes to finish, and is on hold to get his degree. So with the issue of exemptions, without some sort of recourse, they can be denied. And I've seen that firsthand, that they have been denied.
Follow-up.
Thank you, and that's very helpful that you share that. So through the chair to yourself, and this is maybe more of an opinion, you know, when we talk about religious exemptions, is there anyone qualified in our state, in our country, in our world to vouch for one person's health because of a religious belief in your mind?
Through the chair, the person I believe who's best able to make that decision is the individual who holds the belief.
Thank you.
Thank you. Representative Brent.
Thank you, Chairman. From the chairman to the witness, thank you so much for coming to our committee and entertaining all of our questions today. So, a couple of questions, if the chair allows me to go forward with it. You've said Ohio Wesleyan University's in your county, and you said that they just implemented, just for clarification purposes, they implemented a vaccine mandate and that the students have to abide by that for the scholarship. Question, this is actually my real question, Chairman. When it comes to the vaccine, or to a vaccine, and I just want to, just for verification, because it's been a while since I've been in college, don't athletes and students already have vaccines that they have to abide by already when they're in school?
Through the chair to the representative. Yes, they do. Ohio Wesleyan actually has a pre-existing vaccine requirements for college students, but they also had exemptions. And what I heard from past students who had some exemptions for some other reasons was that there was always a no questions asked policy in the past. The student would submit the documentation. There was one student in particular who had a twin who had a severe reaction. And so that student had a medical exemption for that particular vaccine that the twin had a reaction to. The COVID vaccination requirement was handled very differently from what I observed at that university. Previous exemptions that were granted were suddenly denied.
And so that was for any vaccine, they just got exempted, so they were still able to receive their scholarship with the exemption?
Through the chair to the representative, my understanding is yes, there was no impact on any of their academic standing. They just received an exemption. No one made a big thing about it until this year when there was a committee formed to approve or deny these exemptions. And I started getting the complaints from students that are my constituents now.
Follow-up, Chairman.
One follow-up.
Okay, thank you, Chairman. So particularly when it comes to this, you're saying that people don't want to feel like they're being mandated to get the vaccine. I know this bill is not a mandate to get the vaccine. I'm not saying where I feel about the vaccine, about the bill. But particularly, what are you suggesting if people are not getting vaccinated? What do you feel like businesses need to do to preserve the public health of their business in these instances to make sure that people aren't coming to like a super spreader event at work, or we're just going to stick to the workplace because I know you talked about other topics. But what are you suggesting that we do? Are we saying that we need to be implementing mask mandates? I see that you're not wearing a mask, but what do you feel like should be implemented at this point?
Through the chair. So the premise of the question is based on the idea that a vaccine mandate would prevent the spread of a vaccine preventable illness in the workplace. And what the data that I'm reading regarding COVID-19 is showing me is that a vaccinated individual could bring COVID-19 into a workplace and infect other vaccinated individuals. I have a situation in my own family. A very close member of my family was infected with COVID-19 after full vaccination. He spent 2 weeks in the hospital and is still in a skilled nursing facility. So if there was some guarantee that that would have taken care of this issue, then I think that would be a separate conversation from a vaccine that we currently have that doesn't prevent full immunity and still allows people to get infected, unfortunately still be hospitalized, and for over 100 Ohioans unfortunately still die.
Can I just get clarification for that, Chairman? Just from one elected official to another, how would you suggest we should move forward to deal with the public health of this pandemic?
Through the chair, definitely not a public health expert. I think that just speaking from a elected official point of view, I wish that we had more access to early treatment available. I wish that when people were first diagnosed with this virus, we had some options for them except go home and come to the hospital when you can't breathe. I'm not sure how many people we could have saved if we had some more early treatment options. I saw with this individual family member myself that his doctor saw him via telehealth and had no idea that he was in the kind of shape that he was in until my husband and I showed up and took him to the hospital where he was admitted. So if that hadn't happened, he would have remained home. So I'm not sure what the public solution is for this from a health perspective, but I know that we can do better.
Thank you for that. Again, if I wanted to kind of summarize your position, I believe, as I understand it, and please, elaborate if I'm wrong on this, but your concern is, based on the data you shared with us from Delaware County, from your community, as you see it from actual data, not science fiction, that the spread has been not contained as a result of a very high percentage of vaccination, and mandating additional vaccinations for the 20% in order to somehow think we're going to stop the spread and or save businesses from loss of work or loss from their workforce or production. is kind of a fool's errand to run down that road chasing something that, at least from the data you shared with us in your own community, doesn't seem to be bared as truthful. Is that your position?
100% accurate.
All right. Any other questions for our witness? Representative Hoops.
Thank you, Mr. Chairman. Thank you for your testimony. Was it mostly just religious objections, or did they use other ones too, like conscientious and, some of the other ways of getting away from having to take the vaccine?
Through the chair, are you referring to the Ohio Wesleyan situation?
Yes, I'm sorry, Mr. Chair.
Ohio Wesleyan did not accept a conscientious objection at all, so it either had to be a medical or a religious, and for the religious, it had to be a documented tenet of a faith. So they had to be able to bring a piece of paper and say, my participation in this faith shows our opposition to vaccination.
So, Mr. Chairman, so were you here when the doctor from Ohio Health spoke? I mean, he made a comment that said that everybody's probably going to get it sometime, and it's just kind of, if you have the vaccine, hopefully it won't be as bad as if you didn't have the vaccine. Would you agree with that comment then, based on what you've said?
Through the chair, I'm certainly not qualified to comment on the severity of one's infection because I'm not a medical professional. It certainly seems from the information that I'm looking at in Delaware, we can all expect that at some point we will be facing this virus if we're having up to almost a quarter of our cases coming from the vaccinated population. And by the way, that number is increasing. So we were keeping track of breakthroughs, and back in May, we had about 30 breakthrough infections, and now we're to the point of experiencing hundreds. So as I'm guessing that as this efficacy of the vaccine wanes, particularly in those over the age of 60 is what I'm seeing in our data, there are infections happening in the fully vaccinated. 40-something% of our hospitalizations are in the fully vaccinated. And that number really shocked me.
Okay, all right, thank you.
Very good.